Benefits of onions for diabetes. Reduce blood sugar. Quercetin and sulfur compounds in onions can reduce blood glucose by increasing insulin secretion or improving glucose uptake in cells. Improve insulin sensitivity. Onions help reduce insulin resistance, especially in patients with type 2 diabetes. Antioxidant. Quercetin protects cells from oxidative stress, reduces inflammation, and prevents diabetes complications, such as nerve and kidney damage. Support blood lipids. Onions can reduce bad cholesterol, LDL, and triglycerides, improving cardiovascular health in diabetic patients. Fiber. Helps slow down sugar absorption, stabilize blood sugar after meals. How to use onions to support diabetes. Before use, consult your doctor, especially if you are taking hypoglycemic drugs, such as metformin, insulin, to avoid excessive hypoglycemia. 1. Eat raw onions. Benefits. Raw onions retain active compounds such as quercetin and allicin, which help control blood sugar better. How to do. Add 50 to 100 grams of raw onions, about a half medium onion, to salads, sandwiches, or as a side dish. For example, mix sliced onions with tomatoes, cucumbers, olive oil, and a little salt to make a salad. Eat 3 to 5 times a week, best at lunch or dinner. Note: wash and soak in diluted salt water for 5 to 10 minutes to reduce the pungent taste and remove bacteria. 2. Onion juice. Benefits. The juice concentrates compounds that help reduce blood sugar, suitable for people who do not like to eat raw. How to do. Take 1/4 onion, 30 to 50 grams, wash, chop, squeeze the juice or puree, then filter through a sieve. Dilute with 50 ml of warm water, add a little honey, if your doctor allows, to make it easier to drink. Take 1 time a day, 30 minutes before breakfast, for 2 to 4 weeks, then rest for 1 week. Note: start with a small dose, 10 to 20 ml, to test your stomach's reaction. Do not use if you have a history of stomach ulcers. 3. Cooked onions. Benefits. Although cooking reduces quercetin, onions still provide fiber and anti-inflammatory compounds. How to do it. Use onions in stir-fries, soups, or stews. For example, onion soup with carrots, potatoes, or stir-fry onions with beef, vegetables. Dosage: 100 pounds, 150 grams day, 1 small onion, 3 to 4 times week. Note: limit oil and fat when cooking to avoid increasing blood sugar or blood lipids. 4. Pickled onions. Benefits. Vinegar enhances blood sugar control, combined with onions to create a good supporting dish. How to do. Thinly slice 1 to 2 onions, soak in 200 ml apple cider vinegar or rice vinegar, add a little salt, sugar, use diet sugar if needed. Store in a sealed jar, keep in the refrigerator for 2 to 3 days before use. Eat 1 to 2 tablespoons a day with meals. Note: do not use if you have stomach ulcers or are allergic to vinegar. Dosage and frequency. Recommended amount: 50 to 100 grams onions day, raw or cooked, 3 to 5 days, week. Time: use continuously for 4 to 8 weeks, then rest for 1 to 2 weeks to evaluate effectiveness. Monitor blood sugar regularly. Combination: use onions with a diabetic diet, reduce starch, increase green vegetables, lean protein, and exercise regularly. Important note: consult your doctor. Onions can interact with hypoglycemic drugs, causing excessive hypoglycemia. Symptoms: shaking, sweating, dizziness. Always check blood sugar before or after use. Side effects: causes stomach upset, heartburn, or bloating if eaten too much, especially raw onions. May cause allergies in some people, itching, rash. Bad breath can be overcome by chewing sugar-free gum or brushing teeth. Contraindications. Do not use if you have stomach ulcers, colitis, or onion allergies. Avoid overusing onion juice if you are taking anticoagulants, such as warfarin, because onions can thin the blood slightly. Combine treatment. Follow medication, diet, and exercise as prescribed by your doctor. Other foods that support: bitter melon, guava leaves, cinnamon, or fenugreek seeds. Use under instructions. Suggested sample menu. Breakfast: raw onion salad, 50 gs, with tomatoes, cucumbers, 1 slice of whole wheat bread, 1 boiled egg. Lunch: onion soup, cooked with carrots, pumpkin, served with 100-gram grilled chicken breast, 1 cup of boiled vegetables. Dinner: onion stir-fried with mushrooms and tofu, 1 cup of brown rice, 1 glass of unsweetened guava leaf water. Thank you for watching the video. Wish you and your family good health and happiness.